I am Dr. Myles Samotin of Samotin Orthopaedics, here to speak to you today about orthotics. Orthotics are a custom inside lining to your shoe. Orthotics are something that is very much oversubscribed in our world today. I have been an orthopedic surgeon, subspecializing in foot and ankle problems in private practice for over 17 years. And I very rarely prescribe orthotics. Many of my patients come to me with shopping bags full of orthotics that were prescribed by other practitioners, but they're unwearable and don't help them with their problems. Now, if you have the expendable income and wish to have a custom insert for your shoe, what could possibly be wrong with that? Nothing. It would be like having a custom-made suit or a custom-made shirt. It's beautiful, it's form-fitting to your foot, and it should feel better than anything that's off the shelf. But as far as a medical fix to a problem, it simply is often not the case. Many podiatrists consider orthotics to be the answer to everything. It could have something to do with the fact that they charge $500 or $600 for an orthotic, and insurance companies typically don't pay for any of the price, so it's purely an expendable income and it's very good for a practitioner's mortgage payments. However, is the orthotic necessary? In my estimation, no. There are certain foot and ankle problems that are of a chronic nature where an orthotic with medical expertise can be a benefit and can realign your foot so that you can walk more comfortably and walk with confidence. But here in Naples, Florida, I have a busy foot and ankle practice, and I actually prescribe orthotics maybe once every other month, whereas many of my orthopedic colleagues are prescribing them on a daily basis. If you actually believe that you need an orthotic, you should be going to a certified pedorthist. These are people who actually go to school to train to learn how to make orthotics. And not only do they take molds of your foot, but they actually handcraft the orthotic, and when they're ready, they try them on your foot and they make the necessary additions to your orthotic. Much like a custom-made item of clothing for anyone who's had the experience of getting one mold and then delivery of the product is not enough. If you get a custom-made suit in Hong Kong, they take initial measurements, and even if they're quick to make the product, you must go back for 2, 3, 4 fittings because the initial measurement will give a ballpark of what you need, but it's only the second, third, and fourth customized fitting that will actually custom tailor it to you. Most actual podiatrists who prescribe orthotics do not make the orthotics themselves. They have you step on a mold, the mold goes to another location, usually out of state, and what comes back is what you get, because there's nobody at the office you're going to who has any expertise in customizing that to your foot. When you come to me, in the rare instance when you need an orthotic, you are actually sent to a certified pedorthist who will make them for you properly. Thus, I have no financial incentive in giving you an orthotic, and you're sent to the actual most knowledgeable provider who can do that for you. Next time somebody tells you you need an orthotic, take that money, invest it in lotto tickets, invest it in a good meal out, invest it in a weekend away with your family, but don't automatically take $500 out of your pocket and buy these orthotics. It just simply is not necessary, and simply will just wind up in a shopping bag where you'll come to me and I'll tell you that this was not the answer to your problem.